Good afternoon and welcome to this live episode. The topic is cancer, and today we have with us, as usual, Dr. Jolly Thomson, who focuses on lifestyle correction under clinical supervision to reverse and manage lifestyle diseases. As we all know, around 40% of the cancers have a trigger and a background in modifiable lifestyle choices. So that's a big statement. And we are in the process of trying to figure out which more cancers are also to be added to this list. So here we understand basically the importance of lifestyle modifiable factors. Next, as we understand, cancer has an element of fear when it comes in. Whatever be the fear, we understand also that it is best to become better informed so that we take the right decisions. The first question to Dr. Jolly is, what exactly is cancer for the understanding of a common person?
Cancer, when we think, we are thinking as swelling or something spreading all over the body. Basically, this is not happening in 1 or 2 days. It is actually the cell division, that is, our body is changing every day, every minute. New cells are produced. When the new cells are produced, there is this genetic material is doubled or replicated. And this process that actually it is making a copy of our genetic material. For one cell is there, when it is dividing, 2 copies are made. And this copy making stage, there can be some spelling mistakes actually. That is actually our genetic material is written in a 4-letter genetic language. If there is a spelling mistake happening, that cell will be abnormal. And then generally the body has a system that to destroy. If any abnormal cell is born, it will be found out and destroyed by our immune system. Around immune, there are special white blood cells called killer cells. And there are so many mechanisms to find the abnormal cells and kill it. It can be even if senile cells, that is aging cells, can be detected by this mechanism and killing by the immune system. But this process is not properly taking place, and when basically our immune system fails, these multiple these abnormal cells are accumulating, and there will be a genetic abnormalities accumulating inside the cell, and then finally the immune system is not able to recognize these cells, so they will escape the immune system cells and prevent destruction, and they started rapidly going. And in the end stage only, if you are not detecting looking for the cancer, we will be, most of the cases, we will find it only the end stage we are getting cancer. So that is the most important. We have to find it early and try to destroy the cancer cells, or to give support for our immune system to destroy the cancer cells.
Regarding cancer treatment, now we hear so many new developments and all that, but primarily we generally hear about radiation and chemotherapy and surgery. What is it that we should understand about the current status of cancer treatment?
See, in the current modern medical system, there is so much of improvement in the cancer treatment. Previously there are chemotherapy only, and chemotherapy will be having so many side effects and all. But now we have targeted therapy. Even the radiation itself, which is not a generalized radiation like the olden days, it is more focal radiation like brachytherapy and also focal beam. And so many developments are there, and also so many modern, more and more medicines are coming up. And we are trying to use the immune system itself uh, for targeting the cancer cells, like biologicals, this killer cells. We are encouraging, there are this checkpoint inhibitors and monoclonal antibodies. And even we have CAR T cell therapy, that is actually we are preparing special cells of the patient's own cells is tagged with this cancer cell for the destruction of the cancer cells. And that is CAR T cell therapy, that is mainly used in the blood cancer treatment, especially for these children, blood cancers and all. It is very effective. But the thing is, even though there is so much of development, but it has the side effects also. So we should be, and when the patient is accepting any treatment, they should be aware of the side effect and also what is the possibilities. The many of the treatment are may not be that promising also. So they should understand the limitations also. We should not too much hope and too much everything. You should have a balanced attitude. And what is each treatment when you are taking, we should understand. You should try to understand, because after all, the doctors can give the protocols that they give oncologist, and giving a treatment based on the standard protocols actually. Yeah, I'm not. I should tell in that I'm not an oncologist. I'm actually specializing in the clinically supported lifestyle correction. That is not for cancer alone. It is for the general well-being and to correct the body. The health optimization is my focus, and in that, what benefits for the cancer patient. We will be discussing that today. What benefits with a clinically supported lifestyle correction for the cell activation purpose, how it can be benefited for the cancer patients also in the different stages, in the earlier stage or in the late stage. So that we will be discussing today mainly.
The most important thing we commonly see is that most patients reach a diagnosis of cancer later than better. Means if it was diagnosed earlier, it would be better. But usually it is late because of different reasons. Now, how can the public or patients get correct diagnosis in the correct time? What is it? What are the things that they can do?
See, generally we go to the doctor, any patient, when we have a symptom. That is, symptom means fever, pain, or a swelling. Usually the patient, for many of the cancers, if it is externally visible, it is easy to find out. But even the breast is an externally organ, but many of the times even the ladies miss the diagnosis of the breast swelling in the early stage. But we should look for it. That is why we are making awareness campaigns and all. That is the purpose. And for the breast cancer is one of the killing cancers for the ladies. So every lady should be understanding what should be looked for and learn how to find out a symptom of breast cancer. It is simply every early days of menstrual cycle, because just after the menstrual cycle actually, or the 7th day of this menstrual cycle, or just it's make a habit that palpating their own breast and see whether anything abnormal, any swelling. If there is a swelling, definitely we had to consult the doctor. And there are other methods, cancer screening methods are there for different cancers actually. This ultrasound scan for the abdomen, or the breast mammography, and the cervical cancer, the women, that is also one of the most common, and the pap smear is there. And so even without symptoms, we should look for it, and then we will be able to find it out early. And now there is cancer markers are available, but generally the cancer markers is used by the oncologist for the purposes following up the cancer patients after chemotherapy, surgery and all, whether it is a recurrence is coming. But the same tumor markers can be used in the early stage, early detection also, but not in the terms of oncology treatment. Because if you are saying a early cancer marker is positive, that we cannot go for the treatment, because that is treatment with the chemo, radiation and surgery solely can be for the established cancers. But even if you are finding a tumor marker, there not be any, when you do a biopsy, there may not be cancer at all. Or if it is also, it is in the early stage, but it should be used for the lifestyle correction. That is what I am using. Basically, if the patient is interested, because it is not covered under this lifestyle correction, or your healthcare is actually generally not covered in the insurance scheme and all. For this detection, we had to spend money from our own pocket. Only for the established cancer treatment and all, there will be, at least in the Indian scenario, that is the thing. But some of the screening tests are free of cost for the insurance. But all these aspects also to be considered. But if you are interested about monitoring the health, definitely these things can be also be used, and it can be, and you can correct the lifestyle, and then you again see that what is happening. That is what I am doing for my patients.
See, this during cancer regular treatment, one of the things that is very important is how well the patient can actually tolerate the treatment. This is there for all treatments. So any treatment is done, the ability of the patient to tolerate the treatment is of prime importance. But in cancer treatment, it is more into importance because that tolerance level can actually affect the result of the treatment itself. So, in the case of this tolerance level, what is it that patients should understand? Because oncologists will definitely be very watchful of the tolerance aspect. But what can patients, in fact, uh, understand about it, so that they can, in whatever way they can improve their tolerance levels?
See, when the body, we can accept only the treatments which our body can tolerate. Many of the medications in the this, especially in the cancer treatment, they have so many side effects also, because it is most of it is actually trying to destroy the cancer cells. But our body's own cells also will be get affected, because most of these cancer therapeutics medications is focusing on the fast moving dividing cells. The cancer cells are out of control of people. They're fast dividing. So when we are focusing the fast dividing cells, our fast dividing cells, like our immune cells itself, that bone marrow cells, and also the hair follicle, that they are the very fast dividing, and also lining of the our internal tracts like GI tract or the lung lining, lung and respiratory tract lining. So they can also get destroyed along with the chemotherapy agents. Because of these drugs. So that is the major problem we are facing actually. In the modern medicine, there are so many medicines, but it can destroy our normal cells, especially the most vital cells like even our own immune cells itself. That is the problem. So if a patient who is elderly or even along with this problem, there is other comorbidities, 70, 75, senior citizens, usually the cancer comes in when the old age. And there may be other diseases also, like diabetes, hypertension, kidney may be in a compromised stage, liver may be in a compromised stage. And most of these chemotherapy agents also can produce the nephropathy, nephrotoxic, liver toxic, etc. So that is therefore the patient should be thinking because the doctors can give the protocols, can explain the protocols. You should ask what are the complications it can bring also. Then only go for that. Even when you are doing for the surgery, whether if it is how much of the part of your body has to be, organs has to be removed, and what will be the result, and how compromise your daily routines. So such things you should ask the doctor, then decide. Because after all, the final decision is of the patient, not of the doctors. Because the burden of the treatment and burden of the disease both is for the patient basically.
See, regarding this cancer issue, normally people generally have an understanding that diabetes and cancer have some sort of relationship, and these autoimmune diseases and cancer have some sort of a relationship. Obesity and cancer has some sort of a relationship. So in general, people have an understanding there's some sort of a connection. But can we explain in a better way what exactly is the type of connection, for instance, in the case of obesity and cancer?
See, there are at least there are so many type of cancer which is it has a direct relation with the obesity also. That is one of the thing is liver cancer. Liver cancer, if it is obese, there is a fatty liver and liver cirrhosis, and such things are common. Definitely, alcohol is much more than that. But remember, alcohol also is carbohydrate, and it has a connection with the fatty liver also. And so the liver cancer possibility is high for a obese patient. And for the women, this endometrial cancer, the postmenopausal endometrial cancer is definitely connected with there is a higher chance for the postmenopausal endometrial carcinoma. And many other, almost around 13, it is listed itself around 13 cancers are there. So we should understand that this cancer, there is in the obese person, there is more of the fat tissue will be there. This fat, actually our fat is controlling our immune system. And there will be the cancer is an inflammatory disease. And also when the body get more and fat accumulated, it is actually building up inflammation. Now the obesity is also considered as a disease. Actually, we should understand that. If you are understanding and the patient takes it serious, the obesity is a disease, then it will be actually much more easier to understand and to prevention also. Or if you can prevent obesity, definitely the cancer, it is a part of the cancer prevention also. So every patient should understand that this tummy, especially this protruding tummy, visceral fat and excess fat has a thing in the body is inflammatory, and it can trigger many of the metabolic process can be affected, and the insulin resistance, that is one of the reasons for the insulin resistance, and the development of type 2 diabetes, and the accumulation of ectopic fat inside the blood vessel, that is actually presenting as the this heart attack, atherosclerosis, and the block in the coronary artery vessel. Actually, it is ectopic fat depositing. That is one of the reason, and many of the times it is also calcification is coming. That is what is when you look into the calcium score for the coronary artery and all. It is actually, that is a representation of the inflammation. Basically, this if you were able to prevent this or try for prevention of the obesity, there will be a part will be actually it is going along with the prevention of the cancer itself. But even if a lean person also can get cancer, because there are so many mechanisms in even the genetic predisposition and all is there. So, but it is one of the mechanisms. Obesity can promote cancer.
Actually, when we are talking about cancer, many of the fears related to thyroid problems are basically cancer focused, because most of the cases, like if there's a problem with the thyroid, it is usually the fear of the common person that could it become cancerous or something like that. So what is it that generally we should understand about that?
See, everyone feel that when there is a swelling, can it be a cancer? That is why we always look for the biopsy and all. For the thyroid, when there is a nodule or a swelling, we go for a fine needle aspiration, FNAC biopsy. And if it is normal also, there are people who is going for the surgery because of the fear. So it is easy to remove one organ, especially in modern medicine. It is not a difficult surgery. For a surgeon can take it out. It's simple. But we should remember that the thyroid gland has many functions, and especially it is producing 3 hormones. Not actually the T3, T4, and also parathyroid hormone also coming. That is a parathyroid hormone, and gland is nearby, and also the calcitonin. There are 4 hormones it is coming from the thyroid. We can replace only one. So only thyroxine we can replace, and we are losing the function of the calcitonin. We are not getting the calcitonin and the parathyroid hormone, which is very important for our bone and also calcium metabolism. So as much as possible, it is even for the now there is a it's a papillary carcinoma of thyroid is a very slow growing tumor, and there is a active surveillance protocol also, proposal also is there, because you need not remove but we cannot forget that, but we should always look for what is happening. I can give you an example also of a patient who's a very young boy, only 18 years, and he was asked for when he had some cough, and he was gone for a thyroid. The doctor asked him for a thyroid scan, and there was multiple small nodules was there. Actually, it is a multinodular goiter, we usually say, but it was some category 4 or suspicious, but some categorization and all is there. He was asked for a biopsy, and it showed that a higher grade, but not diagnosed a cancer. It can change into. But because of the age and the parents who doesn't want to go for an immediate surgery, they came to me for the lifestyle correction. And he was suffering from this allergic problems for a long time, and tiredness was there. Anyway, when he was put on this clinically supported lifestyle correction, that is actually nothing but giving optimal nutrition, optimal exercise, and reducing toxins. And within 2 months, because it's young age and we wanted to check it faster, and within 2 months itself, the size of the swelling are reduced. And next again after 1 month, because it's a young child, and the ultrasound scan we can repeat at any repeat frequency is not a matter, because there is no X-ray, radiation or any side effects. So we are repeatedly looking into, and actually the swelling is coming down, then we don't have to worry about it. And only thing we had to under follow, and if the child is not following and this lifestyle, and there is a chance that the swelling can increase, in that case definitely we should go for a repeat biopsy and consider. But there are other methodologies also to like a calcification in the ultrasound scan itself, with more calcification, and biopsy is the final thing. So that is the way. It can be, if it is not a cancer, we can definitely give a try with the lifestyle correction, but with monitoring only.
You actually, from the lifestyle point of view, lifestyle disease point of view, you say often that, underlying many diseases and disorders, there are certain common factors like inflammation or insulin resistance and all that. So we also now hear that this chronic inflammation can be linked to cancers in different organs or tissues in the body, and also that chronic inflammation may be of a particular organ or tissue, and then it is related to that cancer. So what is it that the public should understand about this so-called chronic inflammation in the body? Because many in the public are basically dealing or thinking only about diseases. They don't think about something like underlying chronic inflammation. So what is it that they should understand?
See, all the disease and inflammation is very closely connected. The body's defense mechanism is called inflammation. Body's healing mechanism is called anti-inflammatory or healing itself. So it is a preventive thing. When a bacteria or virus or any microbiome invade our, this like a COVID or a streptococcus infection that is commonly come in the throat, our body is reacting. So the body is reacting to for what? To kill that microbe. So if this microbe is attacked a cell, the immune system has to remove it. There is no other way, not partially go and inject some chemical into the cell and destroying the virus. No, they are actually removing the cell itself. Even that is happening in the allergy. If when your allergen is attaching a cell, then finally the immune system, many of the things place that they are removing the cell, that damaged cell itself. So when this inflammation is that activity, and it has so many, there chemicals are used, there are killers, there are different type of killer cells, helper cells, and different types of cells are there to, and also the many chemicals like IgG, IgM, IgG, IgA, and different type of antibodies also is produced for this purpose. And there are leukotrienes, so many chemicals are there. We don't have to go into such details, but basically it's an inflammatory reaction. When there is continuous inflammatory reaction, along with that, our immune system is trained there to remove the cells. For example, this diabetes, it's an inflammatory disease, and when the glucose is going high, the glycosylation is happening, and that is damaging the cell, and the body is under, the immune system is under pressure to remove these glycosylated cells. It is happening when the RBCs are glycosylated, even the WBCs itself get glycosylated, and then they are tagged, they are abnormal. So the pressure of the immune system, the pressure on the immune system will be high. So they'll finally fail, the workload will be over, and then these cancer cells and other cells will be permanently there to destroy, and then their destruction is not happening in the way it is expected. Then we are going into sickness. Even that is happening in the cancer and also even in the infection. When the immune system is not able to tackle the abnormal this bacteria infected or viral infected cells, or the destruction is happening in a too much fast phase, then we feel the symptoms.
See, commonly the feeling is that cancer is very much related to the genes of that person. So if certain issues are there, genetic issues are there, then he is more likely to get cancer. And because of our ability to diagnose and find out genetic material and all that, now at least it is possible for, to some extent, for many people to find out whether they are having any additional risk because of some gene issues. Now, what is generally understood according to latest is that the genes actually, or the lack of it, or the disadvantage of those genes, increase the risk of cancer by reducing the capacity of that individual to handle cancer. So that means that person is he's getting born with a less capacity to handle certain cancers. So what way is it possible for that person to reduce the load of cancer possibilities if he knows that I have this disadvantage with a particular gene and cancer and all?
See, that is the most common example is for the genetic connection with the cancer and the genetic connection. Most common example is breast cancer itself. There is a clearly identified BRCA1 and BRCA2 mutation. So everyone knows that if the mother or the sister is having breast cancer, they will also check. Now it is available. This checking BRCA testing is available. If it is positive, definitely the chance may be higher. But that means doesn't mean that you get the cancer as such. What we had to, in such patients, they had to do? They had to correct their lifestyle and see that all other parameters are in the favorable. Because this accumulated mutations is the reason for the cancer. So if there is some mutation, you are born with a few mutations, BRCA1 or BRCA2, and another thing is familial polyposis, that is colon cancer possibility is there. So for that, usually we do this the colonoscopy and do the biopsies, but it has its own limitations also. So what we can do is find out what are the reasons, what are the lifestyle corrections you can apply for it. And in my practice, what I am doing is when there are patients coming, my sister or my mother had a cancer, and what can I do? What is the lifestyle correction possibilities? What we are doing is actually we look into the inflammatory status. We check what is mainly the body itself, body composition we study. If there is excess fat, we have to correct that. And the inflammation, the background is actually inflammation. So the inflammation is not only the fat, the type of fat. It is omega-6 fat that is inflammatory, and the omega-3 is anti-inflammatory. So trying to correct that balance, omega-3-6 balance, and also the lean mass fat mass ratio getting corrected, and see that inflammatory markers getting corrected. If the patient is having a family history, we'll look for the tumor markers also. We send a group of tumor markers that is commonly, that is CA125, CA19.5, and also the breast cancer. So many of that also. And also this breast cancer, if it is there, we can do a ultrasound scanning. I don't usually send for this mammography regularly, because it is again adding a risk because of the X-ray radiation. So what we are, for the breast cancer patients, what I advise is to do a regular self-checking and teach them how is to be done, and also an ultrasound scan if there is any suspicion, or also it's once in a year we can do that, and make all the parameters to see that their inflammatory parameters, tumor markers, and lean mass fat mass ratio all are corrected, and there is no deficiencies or excess toxin in the body. So give a pattern for the lifestyle correction and following it up, whether the patient is following and getting corrected. That is the way it can be done for a person who is having a risk for cancer also. This familiar tendency for the cancers.
Regarding this treatment of cancer, what happens is normally the patient with cancer may be having other metabolic diseases like hypertension or diabetes or fatty liver and all that. So once this cancer is diagnosed, normally everything else is actually immediately kept aside, because the focus is on surviving cancer. So what exactly can patients do? Because we find that after cancer treatment, usually those patients, if they have recovered from cancer, they are left with many other metabolic disorders like diabetes and hypertension and all that. So during cancer treatment, is it possible to also take care of these other morbidities?
See, when you are diagnosed with cancer, everyone will be in a frightened stage. They don't know what to do. There may be, it will be like too much stress, not only for the patient, it will be too much stress for the family. They don't know how to go ahead. But if you have understanding about the cancer and the possibilities, and that is the importance of getting more awareness about the cancer, then you can be relaxed and you can see what is my problem, and then and accordingly. I can tell you one example. One patient, she's only very young, only 42 years. She has found out with the breast cancer, with the biopsy showed breast cancer. And she is in a depressed stage, and she is not willing, not in a mood for going for the treatment at all. And the husband, and this husband was very aware of this lifestyle correction and all. He brought her for this lifestyle correction, this clinically supported lifestyle correction. And she was, after starting, she was becoming very very positive. Basically, the patient will feel much more positive, and they need more time for final diagnosis and etc. So they wanted to confirm in another hospital. Again, a biopsy is taken, and then PET scan and the result. And they wanted in a particular hospital, there was some waiting list, and it took almost 1.5 months for getting an appointment there. By the time it was a stage 2 cancer, and by the time she was actually, when she was brought, she was her inflammatory markers was very high, and many of the vitamin deficiencies, vitamin D3, folate, and iron deficiency, and so many deficiencies was there. And her fat mass also was high. She was almost, ideally young ladies this age around 25% only fat should be there, but she had around 35% fat was there, and some abdominal visceral fat was excess, and all these corrections we were able to do. Actually, in the initial stage, she was asked for a mastectomy, that removing the breast itself. But by the time when everything is, by the time it is surgery, the oncologist and the oncology team said that she don't go for the surgical removal of the, only the excision biopsy was done, and the lymph node screening and the excision biopsy. So it was a simple surgery compared to a radical mastectomy or a modified mastectomy. This is simple surgery, but the most important thing is she's physically fit, and it's called prehabilitation, peri-surgical correction. So by the time she's much more fit for the face the surgery, and after surgery, depends on the result, we can consider for the chemo, radiation and all. But the thing is, if you get some time before, even if it is a suspicious time, you actually, this patient, that tumor size only reduced, not increased. During the, by the time the diagnosis and the clinically supported lifestyle, starting of the clinically supported lifestyle correction, and this 1.5 to 2 months period was there, that time it was actually the tumor size reduced, but we can't say that there is maybe because of the inflammation size reduction. Anyway, that is, it's a it will make the patient mentally and physically fit for the more tougher treatment protocol actually.
Actually, when we are talking about this cancer treatment, generally, what is it that people should understand about this palliative care aspect? Because sometimes it is considered palliative care is the last part of care. Others think that palliative care is something that should go alongside treatment. What is it that we should understand about this palliative care?
See, palliative care, when there is no curative care, the patient, it's symptomatic relief that is generally considered. In the earlier days, when there is no treatment is available, then go for the palliative. But here nowadays, in the modern medicine, even in the oncology care, the palliative care starts early, so that it will give more confidence to the patient. And it is, many of the studies shows that if you are going into the palliative care in an early stage, then the life expectancy and all is increased actually compared to the other. Because the treatment can, many of the place really the treatment itself is palliative only, because it's already spread is there, not to full removal of the tumor is not possible if it is spread extensively, or many of the cases there may not be that enough effective chemotherapy or the radiation. Radiation definitely, there will be limitation for the radiation also if it is very close to the vital organs. It has its own complications also. So there are so many limitations for the treatment, but you can, if you go for the palliative care for asthma in a clinically supported lifestyle correction point of view, we give palliative care for those who are not even those who are not able to, that if the patient is feeling that if you are not, I don't want to go for the chemotherapy or radiation because of their age or other complications. And I can tell you an example, one of the patient, she is a 71-year-old lady, and she was having diabetes, hypertension, and obesity and arthritis and all. And along with that, she was found out with a tumor on the breast. And the scan and the PET scan showed that it is spread to the lungs and also to the some parotid gland also. There was some secondary sort of thing was there. So she herself, she was a very medically worked in the medical field itself. So she decided, I'm not going for the chemo and radiation. And actually, when we started palliative, this lifestyle health optimization for her, actually one of the most important thing is the diabetes. All her symptoms was gone. Even she had pain on the this side of the breast and the hand also. That and even diabetes medication and hypertension medication and all was without the medication. She was able to control her diabetes and hypertension. And when you are coming with the medicine, her HbA1c was 7.7, and by day 90, her HbA1c came down to 5.4. So that is also very important too. Reducing the glucose level inside the body itself will reduce the chance of growth of the promotion, because the insulin level has a it's a promoter for the growth hormone promoter. Her insulin level was high, 23 was there, but within a month, it's actually within 2 weeks, it came down to 4 insulin level. So that itself will reduce the cancer growth. And that lifestyle with the weight reduction, her arthritis problem was reduced. She was 65 kg, by 3 months she came down to 50 kg. So it's that itself, and she was symptom-free period actually. So that the quality of life can be improved even in a palliative health optimization protocol.
And regarding cancer, what exactly is it that we can understand of the usage of different artificial items like cosmetics and hair dyes and all that? Because generally now there is a slow fear developing that since these things are more commonly used and more importantly regularly used, and even more importantly used from an early age in life, what is it that we should look at? Because generally many of the things that we use in our daily life, only through long studies we are able to figure out whether they are harmful to us or not.
Okay, previously, basically the cosmetics and this hair straighteners and the form, especially this formaldehyde releasing hair straighteners. There was a few studies that it is increasing the cancer possibility to the professional, that is the beauty parlor workers. And also if it is regularly, if you are using, the user also. And we should understand that this cosmetics and the all the cosmetic items, hair dye and the straighten, everything, there is so much of chemicals will be involved. And definitely it will be, this hair follicle is one of the things which will maximum blood circulation. So even if you are applying on the hair, it will go into that hair follicle and can be get absorbed. And when the children, especially in the Kerala, we have a campaign about the schools, that lipstick free campus campaign is running here. That is the reason is that our regional cancer centers are saying that there is few colon cancer, intestinal cancer appearing in the children. It was not heard before. There are child-specific cancers are there, but the colon cancer and intestinal cancers coming in children is a new thing. So that is the reason for this lipstick campus and all. Now, previously it was not a common thing in Kerala using this lipstick for the school children, but now it is becoming a practice. The children is also applying, and everyone want to definitely look is very important. But when you're using cosmetic, you should understand that there is a health risk involved in that. If you want to be healthy, avoid this anything other than the nutrition. That is the basic principle we are what I am in the clinically supported lifestyle correction. Also, advising the patient to minimize the toxins. That is one of the aspects. Actually, optimize the nutrition, optimize the activity, optimize rest and sleep, reduce stress, and also minimize toxins. It in the form of anything other than a nutrition is a toxin for the body. That it can be in the form of food. Even there is excess carbohydrate or excess fat in the food itself is a toxin. Even excess sodium chloride, it's a very common salt, is very needed. We are all using, but if it is in the excess quantity, it's a toxin. And the same way, any cosmetic, especially if it is not a nutrient, it is actually giving strain for your body, and try to reduce it. And especially in children, because their skin, because using cosmetic, it is going, the skin is thin and very well, blood circulation is very good in that, and it can be, absorption rate will be very high. So, all children and the older people, minimize the whatever is not essential, especially not anything other than nutrition is a body considers it as a toxin.
Regarding this diet aspects, generally we hear that those who are having the issue of cancer, they should be avoiding glucose or carbohydrates, and also that that actually will feed the cancer and create more problems and all that. At the same time, we also hear that in case the patient is not otherwise healthy and fit and all that, if he is lacking nutrition, the chances of cancer treatment are also affected. So what is it that patients should understand?
The connection between the nutrition and cancer is very clear actually. And if there is a nutritional deficiency or there is a nutritional excess, the body system, that metabolic overload can come, and it will affect definitely that is the basic reason for all these cell mutations and this cancer cell formation itself. So what our body needs is nutrition, and it should be, there are 57 nutrients as a general concept. That is oxygen, water, and 14 vitamins, 14 minerals, around 20 amino acids, 4 fatty acids, and dietary fiber. So all the and the carbohydrate, glucose. But most of the this cancer patients, especially in the early stage, which is in the late stage, the cachexia and all, they will be very thin because of the disease itself. But most of the patients in the early stage or after the chemotherapy and all, they gain weight. In such stage, definitely the nutrition should be there, but in our clinically supported lifestyle protocol, we use a low calorie, low carbohydrate diet. But all the nutrition should be, all these 57 nutrition should be there, but the reduced in the saturated fat, the fat content, omega-3 should be high. That is actually healing. High omega-3, omega-6, 9 in a proper ratio, and low saturated fat and low carbohydrate diet. So what I understand, basically there is a principle in the cancer diagnosis itself, that PET scan, that is glucose, radioactive glucose labeled tracer is injected for this diagnosing the cancer itself. So the cancer cell the uptake of the glucose will be very high, and this radioactive glucose will be shown up in the scan. That is the one methodology for the diagnosis of cancer itself, or cancer spread and staging and all. PET scan is used. So in my clinically supported lifestyle correction, I give that too important, and reduce the glucose intake also. Our body needs a basic minimum of glucose is needed around 50, that is less than 50, less than 100 grams, 50 to 100 grams glucose. It's enough. That is for the nervous system functioning, some glucose system is needed. But if you are monitoring and giving the body in the correct proportion all the other nutrient, then reducing the carbohydrate is one of the mechanism which can reduce the cancer cell. But you can't say that it will reduce the completely the cancer. It's a cure for the cancer or nothing like that. It can reduce the availability of glucose because the cancer cells use the glucose for their growth and metabolism. So if you are reducing, definitely it is a negative thing for the cancer cell growth.
Regarding women, when there are problems with the uterus, normally the so-called easier solution is removing the uterus and etc., so that they need not worry about cancer of that those organs. So what is it that should be understood? Because any person, if they see that my this body part will is a risk to my whole health or my life, then if it is removed also, it doesn't really affect my functioning and all, then people will be willing to remove like thyroid and uterus and maybe other organs also. But what is it that what is it that we should understand in this context?
Removing an organ with the fear of cancer, that is, it is actually in the current medical situation, that is not needed. We have tests to see whether it is cancer or not and whether it is going to develop a cancer. Only thing, you cannot forget and remove the organ and forget it, because if you remove the organ, fibroid, actually for the uterine fibroid you are asking me, uterine fibroid usually will not change it into a cancer. Actually uterine cancer, the sarcoma, it is entirely a different mutation actually, or the genetic consistency of the fibroid and the genetic nature of the sarcoma is entirely different. So it is very unusual to develop fibroid sarcoma from the fibroid. So for me, I have seen actually most unnecessarily removed organ is one of the organ is the uterus actually. That is out of fear of cancer. But that tendency is actually reduced now. It is even the gynecology sector also. We are trying to protect the uterus. Another advantage is if the uterus is there, there will be a bleeding and the imbalance you can understand. But if the only thing you have to, if there is a problem, you should be willing for follow-up also. But if there is a suspected, for example, if it's the most common is bleeding, if the lady is getting in the menopause time, you get a bleeding. And then when you look into this biopsy, that is now the screening biopsies are there is endometrial hyperplasia. Even typical endometrial hyperplasia also, if the patient is willing for the screening and follow-up, we can deal with the medication itself. Only thing, we just make sure that the patient is getting correct periods in the correct cycle is coming correctly until the menopause is established. And also after the menopause also, you should see that ultrasound scan to see the endometrial thickness. So in that way, those who are willing to preserve their organ, it is always better to have their organ. Keeping the organ is better than removing, unless there is a clear-cut reason. Not to just to out of fear, you should not remove the organ. But if it is necessary, if it's a big fibroids and creating problem for obstruction or bleeding, then you can remove. But there is clear-cut evidence is there, but it depends on the patient's interest also. If the patient is willing for follow-up, only we can wait. But if the patient, I want to remove it, I don't, then do it. It is actually the choice is patient's. Whether you want to preserve your uterus or you want to remove it, it is especially in non-cancerous lesion or just a precancerous condition, it is the patient's choice.
Actually, when we are talking about this cancer treatment and all that, generally this loss of muscle strength is normally seen. That's what we hear. But at the same time, it is also said that loss of muscle strength may actually impact the well-being of the cancer survivor, or later it may be negatively affecting the treatment or recovery. What is this muscle strength and this cancer treatment? What is the connection, if any? And also, for patients who are getting cancer treatment, how much possible it is to retain muscle strength or improve it when they are undergoing these sort of treatments?
See, there are studies when we are talking about keeping the muscle strength, especially in the cancer patients, after chemotherapy or radiation and or the oncology treatment. The study shows that there is clear-cut improvement in the quality of life and also the life expectancy in those who are put in a structured exercise pattern. So that is colon cancer. It is study was about the colon cancer. It is that is published in one of the most important journals in 2026 itself. So there is definitely very clear evidence that if you are doing exercise, your muscle mass is increasing. Not only the muscle mass, your life expectancy and the quality of life will be improved. So in the clinically supported lifestyle correction also, what we are doing is improving the muscle mass actually. Reducing, if the excess fat is there, reducing the fat and improving muscle mass. So not just weight reduction. In the clinically supported lifestyle correction, what I'll give you an example also. This is a patient who is 65 years and his weight is 70 kg and his height is 160 centimeter. So he came after renal cell carcinoma. Is one of the kidney was removed, and again he is facing renal failure also. His GFR is solely 43. The kidney, only one kidney and the other kidney was removed. And he's for a long time he's diabetic and taking diabetes, hypertension, prostate problem is there, dyslipidemia is there, a heart problem is there, and he's had 2 stents applied in 2023. He had a angioplasty with a 2 stent. And the skin problems, because most of these patients they are coming to me is having not 1 or 2 problems, there will be multiple problems. And when we look into the blood test and all the inflammatory markers, HSCRP, CRP, cardiac markers, homocysteine, so many abnormalities are there. And even amylase, lipase, but not only the insulin was high, the amylase, lipase, etc. was high. And he was on many medications when he came to me and tell me that, so I don't want to look into all the, so many, almost 10 tablets he was taking, 10 type of medicines and around a total of 16 or 17 tablets every day. So from that stage, he was by the day 90, with the medicine, his HbA1c was 8.7. Without medicine, by 90 days, it came down to 5.6. And his weight actually, that also is it's a biological changes also we should understand. When he is starting 70 kg and by day 90, it is 57 kg. and his visceral fat is starting, it was 17%, and by day 90, it came down to 9%. And total fat to 32%, it came down to 20%. So that is the change. And by the time he was out from all the medicines, and now it is almost an year, he's keeping, after the 90 days also, now he's keeping fine, and no medicines, and his muscle mass has increased. And basically, before that he was suffering with so many medicine, now is physically fit. And even inflammatory markers, HSCRP, CRP, everything, and the nutritional deficiencies, everything get corrected, and maintaining diet. And that is also follow-up is there for to make he's every 3 months or 6 months he's coming and checking up also.
With that, we come to the end of today's live. In this, we have understood actually cancer is a very complex situation. At the same time, it works or it runs in the biological environment of the body, and for from the point of view of the patient and caregivers, it is very important to see that the health of the person is kept as best as possible during cancer treatment and afterwards, because many a time the cancer treatment with its so-called success also leaves behind other diseases and disorders which sometimes cause the fatality later in life. So correcting the body's biology is very much a part of good treatment, and understanding what one can do for that is very important. Next week, we will be coming with the topic of arthritis, and there we will be going through how lifestyle and lifestyle correction under clinical observation and with support can possibly help in arthritis. And if you have any questions regarding this topic or the next, please feel free to send it on the WhatsApp number that will be coming immediately after this. Thank you.